Alabama lawmakers considering an increase in cell phone and landline fees to create more money for mental health care. Good evening. Thanks for joining us for News 19 at 10. I'm Jerry Hayes.
And I'm Emily Forrester. State leaders are trying to get this bill passed before the end of this year's session. It's part of an ongoing state effort to expand mental health care services across Alabama. Now, News 19's Daryl Burke joins us live in studio now with more on how our phone bills may be impacted. Daryl?
That's right, Emily. Jerry, if this bill is passed by the state, Alabama residents would see a 98-cent increase for their cell phone services. Annually, that means you would be paying nearly $12 extra a year for your cell phone. Mental health specialists say the expanded access would provide services for more people across the state.
Implementing more resources within Alabama will give individuals the opportunity to work with mental health professionals.
Lawmakers say House Bill 389 would add a fixed amount to monthly phone bills, creating more care for individuals suffering from mental illnesses.
The 98 cents would be the maximum if the bill passes that a citizen would be charged.
Funding created by the increase in phone bills would help generate nearly $70 million to expand mental health care across the state. Huntsville Representative Rex Reynolds sponsors the bill. He says expanding mental health care is key to addressing the mental hurdles some people deal with.
1 out of 3 could be impacted by mental health in their lifetime. We've got to get people early. We need, red flags. We've got to identify those individuals and get that crisis care to them as soon as we can.
Therese Stewart is a mental health coordinator with Wellstone, who talked about the importance and the benefits of Alabama expanding mental health access.
It's truly important because it can reduce the suicide rate, it can reduce substance abuse, it can reduce crime, it can reduce various barriers that we're dealing with within the society.
The bill would be an expansion of the 988 Suicide and Crisis Lifeline, where callers are connected with specialists to help them work through suicidal thoughts. Alabama residents would likely see an annual increase of almost $12 in cell phone fees if the bill were to pass. However, knowing the importance of mental health, one resident says she doesn't mind what she called a minimal increase for a good cause.
Mental health access is really important and not something that a lot of people have access to. It's a minimal cost to help bring a lot of help to a lot of people.
It's not about a year like this when we've got 2 of our biggest budgets. It's about the uncertainty of the future.
Representative Reynolds says the bill would create sustainable funding for mental health care in Alabama, avoiding the uncertainty of relying on the general fund. Although the resolution has not been finalized, lawmakers are pushing for it to be passed before early June, when this year's legislative session will end.